to come in, and neither do you want rogue inspectors to come and harass you and least but not the last, get the wrong person certified. So this entire piece will be supported by an establishment of a vibrant labor market information system. So no course will be offered on the HSSC side unless there is a matching job. The worst thing you can do is give a degree to a person and then say, go out and get a job when there is no job for that person. So today, if there is a particular job role which sits out there in the HSSC and 2 years down the road, you find that that job doesn't exist, it will cease to exist on the HSSC site. And we will put in mechanisms to ensure that the person who is certified in that does another bridge course and gets into a job where they can be employed. So that's how dynamic and vibrant the system is going to be. These are the pillars on which it is. The entire standard, as I said, rests upon the industry. What does the industry need? The functional analysis of what the industry needs, the existence standards, if there are any, identified, development of the operating standard, and then approval of the entire occupational standard by the user, not by the academics. The user has to agree that these are the standards by which I will employ people, or people who come into my system should have these kind of standards. And then we need to go out and tell people that when you do your training courses, kindly do them according to these standards. So the job roles for functional analysis which are currently being done, these are the ones in the following buckets using the 80-20 principle. All of this is available on a website. Please do, as I mentioned a little earlier, please do be proactive. Look at the website. If you have any other thoughts, give them back to us, because whatever is being done here is being done for all of us collectively. So if you don't give us the feedback, we can't move forward. So these are the steps in the last 2 years that we have, we are rolling out our initiative. There will be an exceedingly strong, vibrant web portal. We plan to have 5 centers across the country, and hopefully the Western Belt will be, and initially I've heard exceedingly good responses from the institute where we are, that they would like to be here to take this forward. I'll spend a minute out here, which will be of immense interest to academicians. And that is that going forward, if people are aware of what is called the National Vocational Education Qualification Framework, even if you hold a BA degree today, it has to sit in the NVEQF. So right from day one, we will be following this process. This is the snapshot of what it means. Our progress so far has been that we have 44 training institutes affiliated, and we have 5 committed training partners. We have trained close to 8,000 people. 4,200 students have been assessed. These pieces, the job roles, the occupational standards, have brought in a lot of interest worldwide. Asian Development Bank is a partner. UKRI is a partner. The European Union is a partner, in that they are all wanting a piece of this action to see how it's going to transform the way we look at healthcare delivery in our country. And I'd urge each one of you, please do come on board. The NSDC will give you money to start your training institutions. Even if you have small and mid-sized hospitals, please do undertake these training programs. The funding is to the tune of 75%. 75% of the money to do this training will be given to you by NSDC. You only have to do 25%. There are upskilling courses there for people who are already employed but not certified within your institutions. This is exceedingly exciting. Change, this starts with children. We have started in Himachal and Haryana. I would urge you in your individual states, go talk to your governments and ensure that they also start adopting these kind of practices in school. So Standard 9 students today are concurrently going to get a school leaving certificate as well as certificates employable in the form of general duty assistance. So please do come on board. As I mentioned, this is NSDC. These are the kind of certifications. As somebody mentioned, how do you know that this is not going to be false? That particular number there, the moment you scan the number, if somebody comes with the certificate, you will immediately get to know whether this is an NSDC certificate or not. When did the person, this is done back to back with Pitney Bowes. Just a minute on what we have done at MAX. The gap is in capacity and competency. If we keep waiting to just do degree courses, we'll never be there. So we have decided we are going to push on this, start skilling people and getting them into the workforce right away. I just want to show you some, these are some of the schools, ladies and gentlemen. Just look at those eager faces and I'll finish with this. These are 9th and 10th standard students. They are assisting local PHCs, going there, first understanding what healthcare is, going and influencing their families on simple things as to how you wash your hands. If you're able to do infection control with simple movements of cleaning your hands, can you imagine the kind of epidemics that we could stop? So with that, I'll end. I'm here for any questions that you could have. And please do consider partnering as well as investing in skilling, train, train, train. That's the mantra. Thank you.
Thank you, ma'am. Due to lack of time, we can take the questions at a later stage. When I is replaced by we, even illness becomes wellness. Wellness is best described as the constant, conscious pursuit of living life to its fullest. As popularly known, Miss Vandana Luthra is known as the Lady of Transformation. She reached out to the masses and established VLCC as the status symbol for the upper class women today. She reinforced the ideas of women power and that nothing is impossible. VLCC is one of the largest and best known slimming, beauty and wellness brands, and its presence spans over 300 locations in 121 cities across 16 countries in Asia. Today we have with us a representative from this prestigious institution, Mr. Sandeep Ahuja. Mr. Ahuja was responsible for VLCC's foray in international markets based out of Dubai and earlier led the group's subsidiary that manufactures and markets personal care products. He has wide and varied experience of over 2 decades that covers marketing, brand communications, new market development, and profit center management. Besides, he is a member of the Mentor Council for the Beauty and Wellness segment for National Council for Vocational Training Courses. I now invite Mr. Sandeep Ahuja to share his knowledge with us.
Good afternoon, ladies and gentlemen. At the outset, I must sort of confess that I actually came prepared for another subject to do with franchising, but it seems that there's been some change in the schedule. So I'm going to be ad-libbing a bit here, so please do humor me on this and bear with me. When it comes to addressing the capacity gap, I think I must compliment Dr. Singh for having given the comprehensive background on the Sector Skills Council for Healthcare. What I represent here today, I'd like to think, is on the preventive healthcare side of the overall healthcare domain. And that's where I'd like to just give you a quick background on what the current scenario is. Wellness as a concept has been gaining consciousness both in industry and consumers at large for the last several years now. And just to give you a background, we as the Wellness Committee of FICCI, we had 5 years ago realized that there is this industry which is likely to grow with leaps and bounds in the coming years. And fast forwarding to today, we are happy to report that prediction has come true. The wellness industry, as per the latest report of PwC, which was commissioned by FICCI, says that it is a 7 billion rupee industry, which currently is growing at the rate of something like depending on various parts of the industry, growing at the rate of between 18 to 25% year on year. So that gives you some idea of how, for example, between 5 years and now, parts of that industry has nearly doubled. And these are large figures. And when you look at the industry in terms of its size, the obvious question that you ask is, if this industry is growing at the pace at which it is, who's going to be there to deliver the services that are required by the consumer in increasing numbers? And that's where the current challenge lies, as somewhat in the curative healthcare sector. With the fast pace of growth, are we going to be able to train enough people quickly enough? And I must say, today, for me personally and for my colleagues in the industry at large, this is a focus area and a focus area of huge concern. But I'm also happy to report that this focus area is being, to my mind, addressed very, very aggressively. Akin to the Healthcare Sector Skills Council set up by CII, there is also a Sector Skill Council for Wellness Industry that has been set up by CII, which VLCC is chairing. And I must compliment you, Dr. Singh, that you have done great progress on this, but unfortunately, we guys have just started. The Sector Skill Council came into, in fact, it's still work in progress in the sense that we've yet to register the society and so on, but all approvals from NSDC and so on have come. Also, we have commissioned KPMG to do a deep dive into the skill gap within the wellness sector, and that final report, I'm happy to share, will be released during the course of the coming week. But not to preempt the content of the report, but just to give you a few key highlights. One of the highlights is that it is estimated that by 2017 there will be a shortage of over 750,000 people within the industry if the industry continues to grow at the base at which it is currently. So where will these 750,000 people come from? And that's one of the reasons that the Sector Skills Councils have been set up. That's also one of the reasons that the government of India is working very closely with the private sector to plug the gap. I don't know how many of you are aware, but there is an arm of the Ministry of Labour called the DGET, which is the Directorate General Employment and Training. It has done in recent months some remarkably good work in creating things like the Mentor Council for the wellness industry, where they have invited over 20 participants from the private sector and given them a time-bound task to develop akin to what the Sector Skill Council for Healthcare is doing, a NOS for various, which is the occupational standards for various participants of the service delivery mechanism in the wellness sector. The first NOS will be adopted during the course of this month itself. The Mentor Council has over the last 6 months worked with over 1,000 or 1,100 people to develop the standards. Not only develop those standards, but also develop the syllabi that go with those standards if training institutes do choose to take up the program of training wellness professionals. So effectively what we are moving towards is a regimen where professions that were traditionally seen as not careers of choice, but people got into those professions because of lack of any other alternative. This now will be a step towards ensuring that people consciously take up these professions because there is a set curriculum, there is a recognized certification at the end of that course, and also there is a mechanism through which there is a high degree of likelihood that the individual carrying that certificate, unlike a graduate degree, is assured of a job because of the sheer gap in